My son has a blood disorder called severe hemophilia B, and that's just a fancy way of saying his blood does not clot correctly. But I wanted to share something really exciting I recently saw and read about. They are now in the position to start the process of conducting medical trials for gene therapy. Gene therapy can increase factor IX levels. My son, who has a factor IX level of 0.7%, means that he has to have weekly infusions through a vein, and we call this factor replacement therapy. With genetic testing we recently have done, we found that his blood disorder was caused by a random mutation. And we also know 1/3 of individuals who have hemophilia B have no genetic link, which is why it took until he was 8 months old to finally find his diagnosis. An individual who does not have a blood disorder has a factor IX level of 50 to 150%. And if individuals with hemophilia do not have replacement factor therapy, they can have spontaneous bleeding, most commonly found in joints, and 1 in 5 individuals with severe hemophilia, like my son, can have spontaneous brain bleeds. They have also already tested gene therapy in groups of individuals with hemophilia A, resulting in 92 out of 112 seeing an increase in their factor VIII levels. They saw an increase of factor levels up to 35% in individuals like my son who have severe hemophilia, which obviously isn't 100% a cure, but can have a huge improvement on quality of life, which would mean no more weekly infusions, no worry of spontaneous bleeding. Even on weekly infusions, spontaneous bleeding can still happen, which is why we also have extra replacement therapy in our house. And even though my son gets his weekly infusions, his blood levels only stay a certain percentage before it drops off again because his body metabolizes the factor replacement therapy. So gene therapy is only available for individuals who are over 18 years of age, but this gives me more hope for his future. Now, a lot of the questions I get is, well, severe hemophilia A has this treatment or other blood disorders. Now, severe hemophilia B is more rare, so I think that's why there's not a lot of push for different treatment options. So right now for children, the only option is weekly infusions through a vein, which is not the most fun. I'm thankful there's at least a treatment option. But again, this gene therapy would just mean a huge improvement on the quality life. And I'm so excited to read the studies and see what happens. And at least this also gives me hope for my son's future.
Dada.
Yeah, is that Dada?
Hi.